Hi, everyone. I am Dr. Lathiesh Kumar. I am a lead consultant in Pediatrics and Neonatology Department of Aster Women and Children Hospital, Whitefield. I am here to talk about jaundice. So, what is it? Jaundice is actually we see a condition, yellowing of the skin. When the high amounts of the bilirubin is accumulated in the body, the skin turns yellow. So, we are going to discuss on that. Why do babies have jaundice? So usually when the baby is in the mother's womb, the bilirubin is taken care of. That means the jaundice is taken care of by the mother's liver, removing the jaundice. But when they are out, their liver is immature and they don't have the receptors or enzymes. It is because of immature of first 2 weeks, the jaundice tends to be there for first 2 weeks of life. So usually jaundice excretes through the urine and the stools. For that adequate feeding is required and maturity of the liver is required. So next thing is commonly asked question is bilirubin bad? Usually mild levels of bilirubin is antioxidant to the baby, but certainly when the value crosses according to the gestational age or according to the day of life after the birth, the bilirubin is bad. We do follow some charts like NICE guidelines, which is UK based, and American Academic Pediatrics of the US based guidelines on to monitor the jaundice and plot it on the chart. And suppose in the chart we have two types of treatment. One is like phototherapy, one is exchange transfusion. If jaundice crosses certain limit of phototherapy, then we treat. Otherwise, as such, it is not bad. So next common question comes is how common it is jaundice. So usually 6 out of 10 children, 10 babies whom we see is there, they have jaundice. But usually it starts appearing by 3rd day and it peaks by 6th day. So at our hospital, we try to screen for the jaundice at 48 hours of life, and that is called serum bilirubin. And we see it at 48 hours, and we plot it at the chart. And if requires phototherapy, we give. And as I said, it peaks by 6th day and start resolving by the 10th day. So decrease in feeds will result in jaundice to stay for longer, and also if baby is preterm or low birth weight, jaundice is going to be staying for more than 2 weeks of life. So the next common question about the jaundice comes is how jaundice is treated. So usually, as I was mentioning previously, if jaundice falls below the phototherapy range, we don't treat any intervention for the baby. So only we advise is give mothers adequate feeds and establish the feeds as early as possible so that the jaundice is excreted in urine and stools. So by chance, if jaundice is high, the first treatment what we start is phototherapy, which is a specialized lights and with the frequency and wavelength where jaundice bilirubin is able to excrete through stools and urine. If jaundice is still little higher, that means like moderate value, then we use it as a bili blanket, where this is again a specialized equipment where jaundice is treated with a 360-degree exposure of the wavelength and radiance to the baby, so it enhances the bilirubin excretion. But if value goes more than 20 on 3rd day of life, we definitely requires an active intervention where we use exchange transfusion for the baby, where we give the new blood and take the old blood out so that hemolysis doesn't happen for the baby. So that is called the exchange transfusions. So usually these exchange transfusions are needed when mother is negative blood group and baby is positive. The chances of RBCs getting destroyed, hemolysis in a very quick way, and same like if mother is O positive or baby is A or B, we call it as ABO incompatibility, where this jaundice was very high. So we certainly use exchange transfusion to remove the blood which contains the high level of bilirubin so that the baby is benefited as early as possible. Okay, the next common question is, once we treated, many parents ask, then how will my baby have a long-term problems with the jaundice? Certainly, of 90% of the patients, when we treat, certainly there is no any complication associated with the jaundice, but still, considering the value, so the value of the jaundice, if by third day of life, if value goes more than 20, as I was mentioning in Rh negative or ABO incompatibility or extreme prematurity babies, though this bilirubin gets deposited in the brain, it can cause brain damage, the condition called kernicterus. So then the jaundice if value goes very high, that is what I was talking about, more than 25, or minor variants, minor problems with the jaundice can be sensory, hearing loss can be there with the babies. So that can be checked through, one is through MRI and also by the third month with a BERA, a auditory test can be done and checked, and it can be discussed with your doctors before discharge. A couple of lines about our hospital at Whitefield, which is a tertiary unit, which is a standalone women and children hospital, which gives maternal care, newborn care and pediatric, that is what children's care, with all the multidisciplinary team, right from neonatology, which less than 1 month of babies, to take care of any complications. We have a fantastic NICU, which is level 3B NICU, which is a 16-bedded NICU with a neonatologist of 9 neonatologists we have in a team. Then for children especially, we have a multidisciplinary team, right from endocrinology, pediatric pulmonology, pediatric hemato-oncology, pediatric orthopedic, pediatric pulmonary and pediatric ENT, and so on, to give 360-degree approach for your precious babies or children at Aster Women and Children Hospital. Thank you.